This is a recording of a conversation between Associate Professor Annabel Taylor, Dr. Heather Lovatt, and Libby Robbins, Director of New Zealand's Family Trust. Due to the informality of the event, this recording contains environmental noises which unavoidably could not be erased. We hope that this does not hinder your experience of this resource. Thank you.
All right. Well, welcome to you both this morning. This morning I'm welcoming Libby Robbins, who's come from Aotearoa, New Zealand, on a visit, a flying visit. Libby's already done a presentation to the senior leaders in Mackay about her particular model of intensive home visitation services and the effectiveness thereof, the evaluation framework, etc. I have wonderful Heather Lovatt with me too, and Heather is our Senior Research Officer in the Centre. Heather's completed a PhD recently around foster parenting and some of the issues in relation to the challenges that foster parents face. So today we're going to have a bit of a discussion around child abuse prevention, particularly in the context of family violence, and the fact that both the care and protection systems in Aotearoa, New Zealand and in Australia are trying to grapple with how to shift social work practice in order to address family violence more effectively. And there are a number of initiatives, I know, Libby, that you may be able to talk about in regard to that, and Heather, you'll be familiar with some of the recent Australian innovations. So I thought today, we are three social workers, and as such we have a practice perspective around this, and today our discussion is very much around our observations in regard to how the issue of family violence is being and might be addressed in these two great big systems of domestic violence and child safety. So do you want to kick off, Libby, with a little bit of an introduction around what's happening in New Zealand in terms of this interface between family violence and child safety and child abuse?
Okay. Probably the first thing I want to say is that relatively recently we've changed our legislation and we've added a new Vulnerable Children's Act. One of the prime purposes for this change of legislation was a concern about information not being shared between services. There has been a lot of reports, the James Whakaruru case, you remember that one? Right. Where that was a 4-year-old boy, I think, who died. And investigations shown that that information just wasn't being passed around between services. Then we had the Ackland case, can't remember those two girls' names, and a number of others. And so, because of this sort of concern, yes, this legislation's been done.
So there's been you don't mind being interrupted?
No, absolutely.
So there's been a long-standing concern based on some child homicide cases.
Yes.
And that's quite similar to Australia, isn't it? In terms of the influence of some of the child deaths in policy direction.
Absolutely, and I think it's interesting, Libby, what you're sharing with us, because in Queensland we've had a child protection inquiry recently, along with a task force on domestic and family violence, and from those two we're involved with quite substantial reform processes of running, let's say, concurrently, separate, but obviously have linkages, very strong linkages, and information sharing again. Legislation has been reviewed in both under DV and child protection for this very reason, Libby. So there's obviously a lot of learnings across the ditch.
Our Privacy Act actually was getting in the way as well. Our services were actually not handing over information because they misread, the Privacy Act. Our Privacy Act actually has a huge amount of wiggle room in it, that whereby if a child is actually considered at risk, then there's no such thing as privacy, right? But a lot of people have been using that as we can't give over this information because of the Privacy Act, which is absolutely not true if you read the legislation properly.
And so the Vulnerable Children's Act is taking steps to deal with that privacy issue
Yes,
at the moment,
yes,
specifically
yes,
in the
it is.
legislation.
Yes. So the Privacy Act has had some changes to allow. So the Vulnerable Children's Act allows further room, I guess, in terms of the sharing of information. There's also some other interesting things that have happened within the Vulnerable Children's Act, and that is that the CEOs from all of the major agencies have a liability and responsibility for child death, and where that was not the case before. So you might need to go in and read it because I'm not the expert on this.
Yes, that's fine. That's fine. Yes, that's fine. But interesting too, because as I recall, there was some controversy around the naming of the Act.
Oh goodness!
And the Children's Commissioner in New Zealand was very critical. Do you want to talk about that?
Yes, he was. That's Andrew Beecroft, who was previously the Principal Youth Court judge. He had a very critical view on the name, and he saw that as immediately stigmatising. So that was the main issue. He decided that he wasn't going to call it vulnerable children's, the Department of Vulnerable Children, and so he decided that he was going to, from here on in, call it by its Maori name. And I'm not going to say its Maori name because I'll pronounce it wrong.
There you go. Which has a different name.
Yes.
So much considered.
So there has been a lot of controversy around it, but our minister decided that she was going to keep it the way it is, and she's been referring to it as VCOT, which is Vulnerable Children VCOT. Yes.
So I'm going to ask you both a question in regard to this, because we've just touched on the fact that care and protection systems are very prone to these major reviews, and usually as the result of a tragic death. In terms of the most recent legislation, Libby, have you formed a view about whether the Vulnerable Children's Act is going to have some impact on shifting or making practice more effective in terms of child abuse prevention? Any thoughts?
Well, it's very early days, right? But the ability to stronger stuff around the sharing of information, one would hope that would actually make a difference. They've also developed a new database called Vicky, and again I can't remember precisely what that, but V is definitely vulnerable.
Yes.
Vulnerable kids information, something like that. Anyway, that database has been started up or designed, if you like, to allow the sharing of information. And so,
does that mean, perhaps listeners might want to understand what that might mean. So a shared database might mean that a social worker working in a hospital who has a special role in terms of child abuse prevention may be able to access Vicky.
Yes, it
if
does.
she has concerns.
Yes, I've had some training in Vicky, but again, I'm not the expert here. But basically, with the correct access, you can input information about any child that's already on record within Vicky, and folk who are sharing a case can see each other's information. So it really is an information sharing database. So from that point of view, I think it has considerable promise. However, I suppose the sting in the tail for me is that it's a database that's not yet completed, and it doesn't actually have an outcome framework. So that's something that troubles me considerably.
And so your vision, if we think about what an outcome framework might look like attached to an information sharing, informational technology, it might mean that if you are the social worker based in the hospital with child abuse prevention responsibilities, and you refer a child through Vicky, or you follow a child, you load information about a child on Vicky, there's no way that you can track through to see, and if you've made a referral for that child, there's no way that you can track through and see where the child is tracking?
Oh, okay. Well, yes, you can, but it's done in a way that I don't consider it in my language as a real outcome framework. They're using an assessment process called, I've lost it now.
That's okay.
Yes.
So there is an assessment framework.
Yes, an
But it's
assessment
not.
framework. Yes.
Yep.
Tui Tui is the name.
Okay.
With a scoring system attached, whereby the social worker of record, or the lead professional in this case, can use the system to make various changes along the road. So this family is doing really well in this particular domain, so whereby they might have scored, sort of a moderate, that can be changed.
Okay.
But it's an assessment process. It isn't an outcome framework in my language.
There are no measures in
Yes.
there.
Well, the measures are assessment measures,
Right.
not outcome measures.
Yes.
Yes.
Okay.
Yes.
So, coming to you, Heather, in terms of the Australian context, and the Kāmuri reforms particularly, which are similarly trying to address, the horrific number of child deaths, and any child death, of course, is unacceptable. What are your thoughts around where that's at, and in regard to information sharing and the kinds of directions that...
Yes. Well, it's interesting, isn't it? Because across the world, everyone seems to be grappling with the same issues, and now we've got, I suppose, from a political point of view too, one death is too many. Domestic violence, child protection, and of course there's a history of in Australia and elsewhere of a death, a review, an inquiry, and recommendations, implementation. But one of the criticisms of that, two-sided coin, isn't it? And that's what you're describing too, Libby. Action needs to be taken, and it is a really wicked problem, so it's complex. But one of the criticisms of the need, politicians needing to say, well, we need to look at this and we need to do something, is that there's a fairly narrow lens often applied, and other structural aspects are not taken into account, of course. So you've poverty and so on, inequality, housing, etc. So it's an interesting one, and we're most probably would you call it a crossroads? And I'm talking mainly for Queensland, because we're somewhat immersed or just starting integrated response trials based on the recommendations from the Domestic and Family Violence Task Force, of which the government moved very quickly to adopt to say we are going to enact all these recommendations. And as I mentioned to you, what's interesting for us as evaluators of that process is also the fact that the child protection reforms are running at the same time, and there's a recognition there needs to be some governance across both. But of course, we're running into the same things about developing suitable and appropriate information, sharing mechanisms, along with the information platform, technology-wise, that is going to support that, but also round outcomes. So in Queensland, we've all been part, and there are considerable co-design processes so that service providers can work with government to come up with a good program logical theory of change type model to move forward. Of course, what we're all finding is that with all good intent, when you're involving and consulting with a range of people, the right stakeholders, which is happening, but the time it takes, and it gets messier. So time frames need to be flexible. However, West, it sounds like with New Zealand is further ahead in this regard, would you say?
Well, possibly. I mean, we could come back to you, Libby, there, because yesterday you were presenting about the service hub,
Yes,
that you're involved
yes,
with in
yes.
Christchurch, particularly.
Yes.
And I mentioned that in the Victorian Royal Commission, there is also the notion of hubs identified, and particularly the potential for co-location. So you've just recently co-located.
Yes, we have.
So do you want to talk
Yes.
about that process?
Well, been a very tortuous process in actual fact, and it was stimulated by our 2011 earthquake, 2010, 2011, mainly 2011, where a lot of city agencies were dispossessed of their building. We were not one of them. We had the fortunate situation of being in a very solidly built building. But many others were tossed out and for repairs, and buildings were collapsed and all those sorts of things. So that was kind of stimulus. So there was about 6 of us who started considering, what we were going to do about this. But it was more than just co-location. It was to do with collaboration. How can we do things differently? We now have a major opportunity in Christchurch because of all that sort of stuff, to do things differently. So as we went along, some of the originals fell by the wayside. One agency, small little sexual abuse agency, couldn't wait and had to go and sort themselves out because they were sort of getting thrown around by their landlord and had to move several times, those sorts of things. One of the main players collapsed. That was Relationship Aotearoa, and so obviously they
Lost its funding.
Yes. So we were, not quite. All of the originals remained involved, but very clear that they actually couldn't continue except for Relationships Aotearoa. So as time went on, we had to find a site, and we spent some time looking at schools, all those sorts of things. In the end, we settled on a shopping centre. Which farmers trading had exited after the earthquake and just left their tenancy behind.
So farmers is a bit like Target or one of the big chains.
Yes. So here was this huge, enormous area that was sort of going begging, and the owners of the mall decided that they would like to do something different. And so at the same time as we became interested, the local medical centre also became interested, and before we knew what had happened, we had a health and social wellbeing concept. So we negotiated the rental that was being offered to the medical centre. They could cope with because they were a for-profit business, but we couldn't. So we negotiated raising the funds for all of the outfitting ourselves, right? So that took about 3 years, a significant sum of money, but it made the rental possible.
Manageable. Yes.
So we've been there now 4 months. The key partners have been my own agency, Family Health Trust, and Aviva Family Services.
So family violence.
Yes, family violence. Yes. There's a team from the sexual abuse services that are doing a joint project with Aviva. We've got some hot desking from Lovatt.
There's a Māori service
There's a
provider.
Māori service that does a whole heap of different things, mental health, drug and alcohol, a lot of different things. We've now had community law that's moved in, citizen advice moved in, Plunkett's moved in.
Which is terrific.
Yes.
So health, they do the health home visiting at Plunkett is
In the early-
what
Yes.
Queensland would refer to.
Yes.
The
Yes, that's right. That's right.
Yeah. So I think one of the really, really interesting things is that we have a non-competitive heads of agreement. whereby we're all specialists in our own rights, but we've actually made a decision that we will not actively pursue funding that would compete with one of the other partners. So in other words, right? In other words, if government sort of put out a tender for family violence, right, I would not tender for that because that's Aviva's bag, right? Likewise, if government put out early intervention, Aviva would not tender for that. But we might talk about joint stuff. Yes.
So that's really interesting, Libby, because that's one of the observations in terms of the competitive funding model, which both New Zealand and Australia have embraced, in terms of...
And
the
Victorian,
it's not quite as pure as what I'm suggesting, because there is, our local big trust bank, Lovatt Foundation, that used to be the community trust, right? We get funding from them, and Aviva gets funding from them. So, but
there's some trickiness.
Well, it's just that we know that has. So we put everything on the table, and everybody competes with everyone with those major ones. But I'm talking about new stuff that's coming in, new contracts, which could be problematic for one of our key partners.
Interesting, isn't it? Because the Victorian findings, as they did their child protection reform prior to Queensland embarking on the reforms I've just mentioned, one of the key findings was that competitive tendering wasn't the best way to go. So that's something Queensland is struggling with, because we're in a different procurement, if I use that terminology, environment. But Libby, one thing I'm interested in too, because as part of our evaluations of these integrated responses I've talked about, is of course the literature, and it seems that co-location is often seen as one of the facilitators of success. What's your view of how important co-location might be?
Well, what we've done is not just a co-location only option. So somebody who actually wants a reasonable rent in a nice place and a welcoming place, and are not offering anything to the whole collaboration, wouldn't get in the door.
Right.
So it's not an accommodation only option. Yes. You have to be able to offer something to the whole, if you like. And so we offer early intervention services, right? Let me see, I've lost it.
So it's all towards the larger purpose and the health and well-being of the community.
One of the big challenges is actually having a national agency involved. Because national agency tends to have sort of a strategic direction that's nationally and not as necessarily regional. So we had a couple of national agencies involved in the early days, but they couldn't quite manage to actually focus on local because of the conflict with their national strategy. So
there's some of those tensions that exist for organisations. Just coming back to the sort of comparison, thinking about this hub, co-located hub, would you describe it as an integrated system?
Yes, I would.
Right.
Particularly because the new family violence integrated response has actually been piloted out of there.
Right. Okay. Yes. So in addition to this co-location of services, there is an integrated response initiative.
A new one. Yes. And that's a new pilot. And it's based on the previous response actually not working really. So we're piloting a new thing. And it's located right inside the hub. So Aviva Family Violence Services holds the contract for that.
They take a lead role.
They take a lead role on the contract, and they subcontract to Hewa Tapu, who are part of it as well. One of our ideas of innovation and collaboration is that some of these families will have littlies,
Yes,
right?
yes.
And so that's where we might become involved.
Yes.
However, we're still settling in.
Right.
So,
Yes, so it's
so
early
everyone
days,
is, I'm just
yes.
trying to keep your heads above water before we actually seriously look at joint ventures.
So that's really interesting. So with an intensive home visitation child abuse prevention service like yours, this opens the opportunity
Yes, it does.
with this co-location to work closely with a family violence integrated response with that particular focus on children. And that's certainly been a critique of some of the integrated responses internationally. That is, they tended to focus on adults
Yes.
and have less of a child-focused view.
Yes.
So your presence in this co-location and integrated response allows that more
Yes.
child-focused perspective.
Yes.
You also mentioned that you've got a higher risk kind of model happening as well. What was the police involvement with the?
Well, that's the now let me get this right. ISR. It's in there what it means.
Yes,
Right,
that's all
right.
yeah.
So this particular contract is specifically for high-risk clients, right? So those clients that are actually referred to the ISR project are only high-risk cases, right? Very similar to our cases, The lower risk cases, as I understand it, are being dealt with in a different way with some other services.
Right.
And so this is the high risk.
Yes, and Libby, you just referred to the PowerPoint slide, so that will be going up on our website too for people to refer to. So,
So in terms of how.
Service responsibility.
very good.
Yeah. Are you familiar with how the assessment is done in order to determine which families go into the
No, I'm
ISR?
not. I
No.
couldn't intelligently answer that. But it's a triage concept. No, I don't precisely know how it works.
But presumably through some information sharing
Well,
in order to reach a decision around who is at high risk?
Yes, yeah.
Yeah.
Yes, but I'm not sure what the details are.
Sure. And that's led by police or by?
Well, the police has been the main conduit there, right? They've led it. Yes, they will look for the whole change of systems. Right. The police has been a very integral part of that, leading the way.
So in terms of the whole co-location and the whole integrated response, the police have played a leading role?
If you put the co-location kind of sort of here, right?
Yes.
Inside of that is the integrated, the new integrated
Yes,
system
yes,
and
yes.
violence.
Yeah. That's where the police are taking a little
lead.
lead. Right.
Very interesting. Particularly since we're at the early stages of the three integrated trials in Queensland, pilots, one being urban, one being regional, and one being discrete community. But Libby, with the your health home visiting program, you sort of in Queensland we have 6 contact visits. One of those home, I understand.
Right, you're talking about our plunkets.
Yes.
Right.
Yes.
Okay.
But
Yes.
your program extends beyond that and is for high risk families. Do I
Right.
say it in a
I just want to make sure that I'm not confusing the question. Are you talking about Family Health Trust Service? Or
Yes,
are you
the
talking
Family
about
Health Trust
Okay.
Service.
All right. Okay.
I was just applying it to the 6 visits we do in Queensland, or health.
Right. Okay. Right. So she's referring to FHT.
Yes,
specifically.
yes, yes.
Okay. All right. We have a high risk criteria, which is kind of sort of a concept of getting in the door, because Family Health Trust only works with complex cases.
Yeah.
They don't work with those cases who are functioning moderately well, just need a little bit of support and they're off and away. So Family Health Trust specialises in complex only. And
Where do you get referrals from?
well, the referrals can come from anywhere at all. They just have to fill in the tool, and if the information scores a minimum 15 points, they're in. So they're not assessed for service suitability. They're just assessed for risk. Right. So it's a getting in the door concept. Okay. So it allows us to actually define our population that we want to work with really well. So, so anyone can actually make a referral using the same tool. The majority of our referrals come from child youth and family, which is our child protection services. Around 50% come from that, and then about a third from health and various other concepts. In the early days, the majority of our referrals came direct through the midwife services, but since we, for the last 7 or 8 years, had a contract directly with our child protection services, then the majority of our referrals have come back.
You talked about Plunker.
Yes.
Do referrals come from Plunker?
We get referrals from Plunker, yes. Yes, but only about 7 or 8%.
Okay.
Yes. Yeah. Because of the high risk criteria,
Of course,
it
so
attracts
yes.
child youth and family referrals more so than everyone else. Yes.
So it would be true to say that Family Health Trust specialises in that, as you were saying, very complex,
Yes.
very high
Yes.
needs,
Yes.
and on the basis that that requires a specialist response.
Yes.
Yeah?
Yes.
Yeah.
Yeah.
So, and in terms of that specialist response, how would you describe that?
Okay. Well, we have recruited social workers only. We don't recruit any other disciplines. We have, since registrations coming in New Zealand, most of our social workers are registered. So they're very experienced staff. They have small caseloads, well managed, well supervised. We don't put another case on someone's caseload until someone else drops off. So it's very, like we've got new health and safety regulations in our country, and so to ensure that social workers don't get burnt out, we have to be really careful about that. But I don't think I've answered your question actually.
No, I think you have. I mean,
Yes.
the employed professionals who are registered, but you also recruit staff with a particular set of skills. Would that be true?
Well, yes. They've got to have a lot of streetwise knowledge, right? I mean, these are social workers who are going up against gang families, the highest type of complexity that you can actually think of, and so it's not for the faint-hearted. So somebody directly out of a young person directly out of social work school, if you like, would be chewed up and spat out.
Unless
Well,
they
very difficult.
Sure.
Unless it's a mature student, extraordinary.
Yes. Sure. Yes. So because these are families who have been projected and passed on from pillar to post most of their complex life, if you like.
So how intensively do they work? Does each worker work with a family?
Well, as intensively as it needs, right?
Yeah.
It could be twice weekly if that's manageable within their caseload.
Yeah.
But a caseload might, so it's weekly, then it drops down to fortnightly, drops down to monthly, drops down to quarterly, right? So a caseload would have a combination of those things. So this caseload might have 3 cases that have been visited monthly because they progress well enough to allow to do that. So that will allow them to visit twice weekly, a new case if that was required. But they've still got to manage their caseload. They have a lot of autonomy. And one of the things that I've noticed along the years is that it's very easy for social workers to focus on 2 or 3 really, really tricky cases and forget about the rest. And so that's part of our monitoring to actually ensure that actually doesn't happen.
And how long do they keep in contact with the family? What's the duration of their
Well, it's available up until that infant enters our school system. So if we took the case on pre-birth, then it's basically for 5 years. I mean, these are third generation, really tough, complex cases. So
change isn't.
Well, no, like it can take at least 2 years for these families, for these women in particular, to actually develop a level of trust with us.
fully engaged?
Yes, so they're used to being given up on, like the too hard bus, that type of thing. so it's not uncommon for them to test us severely. You know, how difficult do I have to be to get rid of this social worker and reinforce my worldview, if you like.
Yes, yeah.
Yes. So it takes a lot of patience, a lot of knocks, and they're very frequently very abusive clients. You know, so you've certainly got to have more than a fair share of tenacity. And yes, absolutely.
And it's a program that's been evaluated.
Oh, many times. Yes. And the outcome framework that I referred to, that I have some concerns is not available within children's teams and within the Wiki database, the Wiki database, is something that we've been developing over many years. So it's a series of quantitative questionnaires, and I think we're into the 7th iteration. Yes. So we've just built on it. And the last outcome evaluation that we had done, that was an outcome evaluation, was 2009, and we recognised some problems within our data at that particular point. So we kind of decided to throw everything out and start again. And so then that took us about 5 years to complete that. And then of course we needed a new database. So technically we had to actually start the cohort all over again. Yes.
So there are some challenges around evaluation, particularly around outcome.
Yes.
And that's certainly something that we're, that Queensland is grappling with currently.
And I think there's a lot of confusion between what's an output and what's an outcome as well. Yes.
And that's one of the debates.
And our NGO sector have only been required for their funding to deliver outputs.
In Queensland it's the same. Yes.
And about 5 years ago, I think the language started to change. In terms of this, and outcome language was used a lot more. Evidence-based practice was language that was becoming much more familiar. And relatively recently, our national government did a line-by-line review of the NGO sector, and were understandably very alarmed at how little information they had, because the sector had never been required to produce evidence of their service effectiveness before, right? And so they didn't have it.
Just picking up on that though, because we've had quite some discussions around this. It is a huge issue though, isn't it, for services in terms of their resourcing, their expertise, in fact the other question I would raise is in regard to governments taking responsibility and leading the way with their own evaluation, investment and in technology. Because it seems a little problematic to rely on NGOs that have pretty prescribed funding arrangements to be able to invest as much as you have, Libby, in terms of evaluation.
Well,
you got any thoughts on that?
Yes, well, I mean, it's interesting that you should say that, because I was involved in a so-called expert committee on this issue quite some years ago, and the idea was that all of our contracts would be very outcome focused. Some tools were discussed in terms of how that would look like, and at the same time then child, youth and family were going to be expected to do exactly the same thing. So this was a cross-sectoral thing. State sector and the NGO sector actually having the same shared responsibility, but it ended up on a dusty shelf and never went anywhere.
Right. Yeah.
So
it is complex.
Yes,
it is complex, and this
yes.
and grappling with
Yes.
that, and as you say, what is it, that definition of what's an output and what's an outcome can become blurred. But obviously with the Queensland focus at the moment that I've got, I mean, there's both very good work taking place, but it is time consuming, and when you include all the stakeholders, you know, that collection, and then to then say, well, what's the best model or framework or whatever it might be. But it's certainly interesting times, and we're almost, a couple of times Libby was talking, it's almost like ditto.
Okay.
Yes.
Yeah, I think it's an attitudinal thing as well, because the NGO sector has traditionally, because they've been funded for outputs, right, there hasn't been anything in their framework that actually said, hang on a second, we have a responsibility here if we're getting funded to actually provide evidence of what we're doing in terms of outcomes, not just financial evidence, right? So, and then there was an awful lot of, well, it's too hard, you know, like you can't measure this sort of thing because it's too hard. So,
and it's often long term,
yes,
you know, to get some of the outcomes.
So I think the difference between my service has been that, yes, we viewed it as hard, but we also viewed it as something we had to do.
Yes.
And so we just tracked along that area. Yes, it's hard, but we've got to find a way.
And I think for the NGO sector, yes, it is hard, but I'd be remiss if I didn't say that some of the anecdotal, you know, information that's provided to us is that sometimes some NGOs try to collect, you know, because they are interested in outcomes, and they have different mechanisms, but of course they're not coordinated, or they do their own reviews or evaluations, and again, because it's not specifically funded for that, often they don't aren't shared, and there is an interest, but it is hard given the funding, you know, constraints. So I'd be a bit remiss if I said we hadn't had shared with us from non-government organisations some very good work they're doing, but as you say, Libby, if you're reporting on outputs, unfortunately, it's not harnessed, is it, for evidence-based purposes?
I mean, I think our journey started, you know, sort of way back in sort of 1992 or something like that, when after a discussion with one of our local researchers who said, looks like you're doing good stuff, but you can prove nothing. And it kind of started us on a journey, you know, like it didn't matter what I did, I couldn't get that out of my head. And from there on in, we've always made sure that on our board we've had a, you know, somebody who's got a focus on research, and Annabel was on the board for a number of years. And so it's kind of like, I mean, I want to know where we need to look at. Like, I want to know that. So
because it's such an important field.
Yes.
And have we made a difference? We think we have, but have we? No, we have.
And I mean, truly, if we got a bad service, right, or the evidence that we have is all negative, right, then we should be out of here. You know, like we should be closing up and going away. You know, our clients are very vulnerable. We have a high level responsibility to provide evidence that we're not doing harm. And in order to do that, you have to provide evidence that you're doing good. It's no different from financial auditing, you know. Like, we're required to give evidence that the money that we're given to spend on a certain thing, that we do just that. So what's the difference between that and, I guess, social auditing? You know, you know, I mean, I've had several arguments with ministers who worry about services being removed from areas because perhaps the service hasn't been uptold, or perhaps whatever reason. And I really hold the view that harmful services, bad services, is far worse than most services. That's my view. Yes.
Well, I think that's possibly a really good point to finish up our discussion. We've kind of traversed some of the similarities between the two jurisdictions and the recent reforms, which are sounding quite similar. It'll be very interesting to see the data that comes out of the co-located hub and the integrated response
Yes,
in Christchurch, and of course there will be some results coming out of the trials here. But I guess I'm listening in that last discussion with a mind to the social services perspective, which is something which you raised right at the outset, Heather, and that's those factors which are really problematic to measure. And I'm coming at this from a researcher's perspective in terms of outcome frameworks and which influences and variables are sitting outside the intervention and impacting on the effectiveness of the intervention.
Yes, like income.
Exactly.
Yes.
Exactly.
I think you're looking at this was really useful.
Oh, well, thank you both. We've had a very interesting discussion.
Thank you. Great.